It is the overview of my presentation, including overview of Afghanistan, background of maternal health and health system, what was done, Afghanistan mortality survey, and factor to contributing to reduction of maternal mortality, and next step and challenge. As you see, Afghanistan is a landlocked country with 27 million population in 34 provinces and located in South Asia. As you see, Afghanistan had very bad maternal health profile in 2002. Our health system was destroyed, and infrastructure was the same, as well as destroyed. And as you see, there was, on that time, there was 27,000 women were dying annually due to pregnancy-related complication, and in every 27 minutes, one mother were dying, and majority of these deaths were preventable. The main causes were hemorrhage, obstructed labor, sepsis, and pregnancy-induced hypertension. As I mentioned, Afghanistan had worst health indicator in the world: high maternal mortality, low antenatal care coverage, low delivery by skilled health provider, and also high fertility rate, as you see. So the government of Afghanistan and Ministry of Public Health with our development partners, the donors, we had common agreement on developing health system, developing policy, strategy, and support best practice, creating an enabling environment for implementation of this strategy. And developing health system, basic package of health services and essential package of health services, national reproductive health strategy and maternal health strategy developed, and also national midwifery education program established. It was a first step to strengthening health system, and also increased access and utilization to health services. In this regard, support education and deployment of large number of midwives that were qualified to provide emergency obstetric services, and also scaling up community-based healthcare. This was another step. And to increase the demand and expand the services, change behavior and create, develop IC and BCC materials, and also mobilize the community through this. And developing also another program, establishment of community nursing education program. As I mentioned, our health system, the main and the first priority was basic package of health services. This was implemented and is implementing through the contracted out and contracted in procedure modality. And the main facility, type of facility are mobile clinic, sub-center, health post at the community level, basic health center, comprehensive health center, and district hospital. The secondary level or services are essential package of health services. This service delivered by Hospital Reform Project and also government. And the type of facility are district hospital, provincial hospital, and regional hospital. And also we have another type of facility that are specialized hospital, including maternity hospital in the capital of our country, Kabul. And also private sector was growing during this period, and also we have a private clinic, hospital, pharmacies, and diagnostic center. These are the type of health facility in our health system. The other intervention that we had standardized and improved quality of maternal and reproductive health services. One of the steps was strengthen basic emergency obstetric care and comprehensive emergency obstetric services. And also, as we mentioned, establishment of community midwifery education program was a response to one of important challenge. It was lack of skilled female health provider. This initiative it responds to us and increase the number of qualified midwives to provide services, especially emergency obstetric services to the community. And also performance-based standard developed for primary healthcare provider, and supportive supervision was another intervention that we had. And also improve the quality of services through in-service training, and it was with providing training, competency-based training through the competency-based training material. After this intervention in 2010, Ministry of Public Health and its development partner decided to conduct a national survey to assess the health situation. And the Afghan mortality survey was a national survey that conducted in 2010. And the main purpose was to provide information regarding the maternal health, maternal mortality, child and adult mortality, and also cause of maternal death and life expectancy, marriage, fertility, and family planning, and also socio-economic indicator. This survey, funded by USAID, UNICEF, and WHO, with the Ministry of Public Health, with the Central Statistic Office, by technical support of Macro, ICF, IHMR, WHO, and UNFPA, conducted this survey. And this survey covered about 24,000 32 households in 34 provinces, some rural area due to security reason excluded. As you see, the result of services, this survey brought good news to us, and we found that maternal mortality reduced. It is 327 per 100,000, and also coverage of antenatal delivery by skilled birth attendants increased, fertility rate decreased, and life expectancy increased. As you see, it was 46, and it increased to 61 in female and 62 in male. And also as you see, the other indicator, we have good achievement and improvement. And as we compare Afghanistan in the region, it has still highest mortality. So which factor, question is that, which factor contributed to the reduction of maternal mortality? Our government was committed and made priority the reduction of maternal mortality, as it was commitment in Kabul Conference and MDG Summit. And also MOPH, its partner and donor, all were committed. And having a model health system, developing model health system, it was another success. Increase and some initiative like midwifery education program. As you see, our midwife was 467. It increased up to now to 3,200, and also other scale up emergency obstetric care and improve quality of services. And also message regarding the ANC, PNC, and danger sign developed, and OEC and BCC campaign conducted, and also implementation of a pilot project like prevention of postpartum hemorrhage, family health houses, and postpartum family planning at the community level. This program was piloted and and brought good result to us. What would be the next step? Based on the result of AMS Afghan mortality survey, we would continue to increase the number of midwives up to 8,000 by 2015, and also we will improve the quality of services through providing comprehensive EOC services and basic EO services, and also equip the facility and with staff, qualified staff. And also improvement of immuno services and increase the community participation to the maternal health services, and also strengthening referral system. One of the main issues that our country has geographical disparity. How to strengthen referral system, it is another step that we would do. And improve monitoring of maternal, newborn, and child health services, and increase demand of community. But still we have challenge. To overcome this challenge, it needs more support and efforts. Despite of these gains, we have challenges. Still, 80% of 80% of delivery taking place at the house, at the community level, and without scaleboard attendance. And also maternal mortality is high in the region. To address this, and also there is inequality in access service between urban and rural area. Who are most at risk? The girls who have early marriage, and also girls who are not educated, and half of women under 20 years old, they have no formal education, and they are at risk with high fertility and malnutrition. So this challenge requires multi-sectoral approach to address this challenge. And other challenge, as we mentioned, the limited number of skilled health providers and coverage of BPHS. Still, we need to cover 100% of our provinces and country. And these gains are fragile, and donor resources are declining, and it needs substantial investment to maintain and safeguard these gains. And I would like to say it was a joint effort by our government, our development partner like USAID, UN agency, and international and national agencies, and also our health provider. And we made this progress by joint effort and very strong commitment in this regard. Thank you. Sorry, I was in a hurry because the timekeeper reminded me time is limited. Thank you.
Thank you.